own private operating room. But then you go through healing, and basically all you got to do is give it time. So, day one, after you have the procedure, all we want you to do is take it easy and follow the directions. We make this so simple. All right. But understand this, by day three, we want to see pictures. We ask you to send us pictures every 3 days. By the week one, you're into a routine because we're telling you what to do every day as you're going through this 40-day period. Same thing happens week two, all the way up to week four. By week six, it's over, dude. This is when you can actually start back having sex. All right. So, but I always tell guys, I want you to go easy. And I try to get it across to guys. I said, look, what I mean by going easy is that if you're having sex, I'm talking about 3-pointers, layups. But dude, you can't go in there trying to slam dunk. You got to take it easy. Why? Because we want you to protect the skin. Now, our healing period goes all the way out to 90 days, 3 months. After 3 months, slam dunk, hang on the rim. It doesn't matter. Break the backboard. It doesn't matter. That's all you now. You've completely healed up. So, the thing I try to get across to guys is don't judge your results by what you see in the first couple of days. You got to give it time. All right. Now, this 40-day rule. All right. So, why? Because we use a filler. All right. Basically, our filler is a biostimulant. It's going to cause your body to make its own natural collagen. So, during that period of time, I want you to give it time to heal. I don't want you having sex or anything like that because you can cause things to be lumpy, bumpy. So, we tell you during that first 40 days, I don't want you to do anything with it besides just pee through it. Leave it alone. Follow the inflammation. Follow the information that we give you. We make this extremely simple. There's no guessing. All right. And we always tell you do not have intercourse during this time. And guys, no masturbation. All right. Just leave it alone because you can actually masturbate and injure the skin. All right. And that could be terrible. All right. Now we got an issue. Why? Because you were hard headed and you start doing stuff we asked you not to do. And when we finally get to the point of sexual intercourse, we always tell you to use lubrication. All right, because you got to realize you're much bigger now. All right, so just can't jam it in there. You got to go easy because you're trying to protect your skin. All right, people often say, "I feel fine." We want you to feel fine. All right, we want you to feel fine, but that doesn't mean that you're healed. All right. So feeling fine doesn't equal being healed. So wait until we tell you that you can have sexual intercourse. Just follow our rule book. That's our point. The biggest complication we see isn't because the procedure failed. We're not having problems with the procedure failing. It's because someone thought they were healed and they start doing things we asked them not to do. Here's a question. If your doctor gave you instructions, what that could protect your results, would you actually follow them? I have guys say all the time, Doc, I follow results. I follow instructions. I follow instructions. And then they go do stuff that's just totally knucklehead. I'm like, why'd you do that? All right. So why we ask for progress photos? Because we require photos every 3 days. So the question becomes why? Why do we want photos every 3 days? This is unique to our practice. This is what we do. So here at Your Heart for Men, if you come and have male enhancement done, this is not a wham bam, thank you, ma'am type of procedure. Basically, you're our responsibility for the next 40 days, next 90 days. We want to make sure that you're doing fine. You got to stay in contact with us. We give you our cell phone numbers. We got your cell phone numbers because we want to monitor your healing. I want to make sure that you're doing fine. I want to identify any problems early if you should have any. All right. I'm going to be providing assurance. If there are things that don't look right, we're going to be telling you what to expect and what to not expect, what not to expect. And also, I got to adjust your I got to be adjusting recommendations as we go through that period. So everybody's different. Some guys, I got to hold their hand really tight. Some guys, I can just hold the hand loosely, but we're always holding hands. We want to make sure you get through the healing period. So, this is why we want pictures every 3 days so we can watch you closely and make sure that you're fine. And these photos help out because we want to see how you look with the wrap off. I need to see that your skin is healing fine and that you're not having a problem. And we want to see you with the wrap on because we want to make sure that you're doing what we ask you to do. And we're looking always to make sure that that skin is looking just fine. And we're looking for anything that you might be doing well. Or I'm looking for those guys that are doing things outside of what we ask them to do. All right. We can tell if you're starting to have sex too early. So understand this, your progress pictures aren't just for us, they're also for you. Why? Because your results is what make all the difference. And that's what we're looking for. So, the biggest mistakes patients make, here they are. I'm going to run them down because guys make these mistakes. They start having sex too early. I tell them 40 days, 40 nights, and then they start back before then. You got to give me 40 days, 40 nights. Why? Because you're building all this new cellular matrix. Just leave it alone. Another one is masturbating early. Guys, for those masturbators out there, just leave it alone. Just for 40 days. But you can actually injure the skin. I've had a guy that did that. We had a serious problem because he started masturbating with no gel, just rubbing it, friction, destroying the skin. And yes, some skin came off. He did it to himself. He's all healed now, but that's not something we want you to do. And we put it in writing. Don't do that. Ignoring instructions. Guys, we give you plenty of instruction. We tell you what to eat, we tell you what to take, we tell you what to do every day, we give you our cell phone numbers. All right? So we do all this for a reason. Why? Because I got guys coming from all over the country. So I'm following them closely. And then those guys, after all that, you're not doing your follow ups. And the follow ups basically for us are to send the pictures. That's how we follow you. Like I said, this is not a wham, bam, thank you, ma'am type of procedure. I want to make sure you get the results that we're looking for. So, these guys, the mistakes that they're making is they're not sending us the photos. Some guys we have to actually call them and say, will you please, Mr. Williams, Mr. Jones, will you please send us photos? Because why? We want to make sure. Now, when you send these photos, we want them to come to our medical records. All right. So we do have that set up where you send your photos and it comes directly into our medical records. So, don't think that you're just sending out dick pics. All right. That's not what's happening. Another problem is, you know, excessive alcohol. But what I'm really more worried more about is excessive smoking, right? Because smoking actually can cause vessels to constrict and you're decreasing healing. So anytime you're trying to heal, if you're a smoker, a big smoker, that's going to cause problems. All right. I know guys going to say, hey, are you talking about cigarettes? Or are you talking about marijuana or something like that? I'm more concerned about nicotine causing vasoconstriction. All right. Heavy exercise too soon. Understand this. If in certain positions, the penis will actually pull back into the pelvis. All right. So I'm telling you to avoid squatting and all this other kind of stuff. We tell you when you can do upper body and lower body workouts. We're all that information's there. So don't go doing stuff that we're asking you not to do. And then the one thing that really messes guys up mentally is they're comparing themselves to somebody else. All right. This is all you. We ain't trying to compare you. You want to steal your joy? Comparison is a great way to steal joy. All right. So let me tell you a story. And I'm not trying to identify anybody, but these, we're kind of talking about things that go wrong or when somebody does something wrong. All right. I actually had a patient. He did fine surgery. His procedure went well. We give you all the supplies. This dude actually, he used up the supplies too fast. I guess he was just putting too much on there because we talk about a triple antibiotic cream. So he went and found a cream in the cabinet. He said, looked like the cream y'all gave me. So he was like, I need to put a cream on there. So he put this cream on there that he had in his cabinet. And I'm like, oh Lord, what did you do? What did you put on there? Of course, at this point, I'm like, what did you do? Well, this dude put preparation H on his penis. And what happened? It took the skin off. Why? You got our cell phone numbers. You know how to contact us. We gave you a list of do's and don'ts. And then you go out and you do something like that. Yes, he healed up fine and he's doing great. Skin recovered. But these guys, I got guys coming from all over the country. I got guys coming internationally. We are very strict about what to do as you're healing. So there was no reason for that to happen. All right. The other big thing that I run into is just guys having sex too early. Why can't you give me 40 days, 40 nights? All right. They did in the Bible. Just chill. 40 days, 40 nights. All right. And then after that, you can start out slowly, but healing goes out to 90 days. All right. 3 months. So the question is, when should you call your provider? When do you need to worry that something is actually going wrong? If you should have increasing pain rather than decreasing pain. Usually, we don't really have problems with pain. All right. But if you start having pain, you need to give us a call. Why? Because you got our cell phone numbers. So you got to give us a call. What if you start having fever or chills? That's a sign of infection. We're not usually seeing this problem. Why? Because we put your antibiotics before surgery or the procedure, and we put your antibiotics afterwards. So we're covering for that. So our infection rate is basically zero. Why? Because we cover for that. What if you got rapidly spreading redness? Oh, yeah. Then I'd be worried about, is there something going on? Is there allergic reaction or something like that? You got to call us. You got to let us know. But we're going to pick up on that too because you're sending us pictures. All right. We want to know. Do we see that? No, we're not seeing those kind of problems. But that's because why we follow guys so closely. All right. What if you got significant bleeding afterwards? Okay, maybe you're a guy that, when we ask you about your medications, because we're going to go through your history, we're going to go do a physical, we're going to talk to your medication, talk to you about your medications. Why do I do all that? Because I'm a doctor. I've been trained to do that. But what if you didn't tell me that you were on a blood thinner or that you were taking aspirin every day or, you were doing some kind of fish oil or something that caused you to bleed more? All right, so now you're getting more bleeding. All right. We used to always say this in surgery that all bleeding stops eventually. I know that's a inside surgical joke. But the thing is that we don't want you to have that problem. Just leave it alone. Any questions for me so far? All right. There's been a lot of questions, but we've been answering. Okay. All right. So I know guys are hitting us with questions. Lisa's answering those questions as we go. She might throw one or two at me, but no big deal. I'm going to keep it going. Any concerns that seem out of proportion to be expected during recovery, just give us a call. You got our cell phone numbers. How many times I got to say that? Once you actually come onto my team, you're our responsibility. So never be afraid to call. We'd rather answer a simple question early than manage a bigger problem later, simply because you're our responsibility. We want to know. There's so much crap out there. Where are you going to go where somebody's going to baby you like we're talking about? All right, here's some rapid fire question to answer. Make it come quick. All right, here we go. Common questions. Can I shower? Yeah, we want you to wash your musty butt. Yes, you definitely can shower. And we tell you about how to cover it up and take care of it while you're in the shower. But every day 3, you're going to be change your bandage, and we tell you how to wash it, with simple soap and water and all this, and pat it dry. The other question is, can I drive? Yes. I want you to walk up out of here. Guys come here, they get in their cars and they drive home. Can I fly? Well, let me tell you a story. I can tell you that when I had this procedure done, because I've had it done twice. Every time you get it done, you can get bigger and bigger. I've had it done twice. I've been told that I cannot have it done again. Read in between the lines. All right. Now, the thing is that this is what happens. What happened to me was that I had the wrap on, and I'm going through there and, I'm at TSA and they tell you, you got to take all the stuff out your pockets, whatever. And I go in there and they tell you to step right here, sir, put your feet on the marks. And then the thing circles around you. And, and basically it identified that something was going on right there. So when I stepped out, and guys, this is true. Now, if you go on my Instagram, I talk about this on Instagram. Actually, I show some videos of it going on Instagram where I'm going through TSA, and the guy was like, "Sir, there's something going on down there." I'm like, "Yeah, I just had a procedure." So, well, sir, we're gonna have to check you. I'm like, dude, because I'm proud of my stuff. I'm like, yo, pull it out right now. I start unbuckling my pants. I said, we can just pull it out right now. I'm telling you, it's just a bandage. I start reaching in. Oh, you're fine. You're fine. You're fine. Dude, pass me down, lets me go. I'm like, yo, I'm going to whip it out right here now. Why? Because I'm proud of my stuff. All right. That's my story. So, yes, you can fly. Now, can you go back to work? Yeah, you can go back to work. You can climb ladders, you can climb up in the truck and all. We just don't want you doing a lot of squatting because squatting pulls the penis back into the pelvis. Can I go to the gym? I touched on this before. Yes, you can go to the gym, but I just really want you working upper body and not lower body. But because this is permanent, just give your body a break and take it easy for 40 days. That's the best thing to do. And then you can get back to what you want to do. Can I sleep on my stomach? Well, I prefer that you don't. All right, because I don't want you to put pressure on there as you're developing this cellular matrix. So we ask you to sleep on your side or sleep on your back. So we try to avoid sleeping on your stomach after the procedure. Can I drink alcohol in moderation? But I'm more concerned about the guys who are heavy smokers out there. All right, because they're attenuating blood flow. All right, so understand that. How long before it feels normal? Well, that's part of the healing process. During that 40 days, everything's going to start looking normal by week 2, 3. But I need you to take it easy and don't think that you're not still healing because all that cellular matrix is being formed. When will the swelling disappear? Usually that happens around about week 2, 3. That's when things start looking like it's all you. But understand that you may actually get bigger during that time. Remember, we tell you we expect you to pick up 3¼ to an inch. I mean, and that's on the small side for us. Our guys are picking up 1.5 inches, 2 inches. All right. That's how we roll. Why? Because we know all the things to do. Why? Because we're the medical guys. Now, let me bust some myths out there because there are always some stuff out there that's false. And I'll tell you if it's true. If I feel good after 2 weeks, am I healed? Hell no, you're not. False, and don't do it. I said 40 days. You're not healed. I know you feel fine. Everything's great. Just leave it alone. Here's another myth. Everyone heals at the same rate. No, everyone doesn't heal at the same rate. I got guys out there with terrible eating habits. All right. Or what if you're a diabetic or a smoker? You're not going to heal the same rate as anybody else. For my diabetic guys, understand this. If you're a diabetic, let me make this clear. I'm going to want to know what your hemoglobin A1C is. And if your hemoglobin A1C is greater than 8, we will not do your procedure. Why? Because you're not going to heal correctly. Now I got to babysit you and take care of you till you finally get through all the process because you heal slower. That's what happens with diabetics. Their blood flow is jacked up from all that glucose. So the thing is that I'm gonna tell you right now, I want to know your A1C if you're a diabetic. And if it's greater than 8, we're gonna be putting you on hold. I do that with just about any surgery. If you're getting a circumcision, whatever, I always tell you, you got to be at least less than 8. Otherwise, you're going to be somebody who's going to have a problem. All right. Another myth, the procedure determines the result. Well, that's only partly true. And that's why we're having this conversation, because recovery is equally important. So that's why I'm stressing this whole thing about recovery. Here's another myth, progress pictures actually matter. Hey, that's true. I want to know how you're doing. And we're documenting and we're following how you do throughout the whole procedure. I mean, the whole healing process. So, I got a lot of surgeons in my family. I got a lot of doctors. Let me say that way. And my uncle, who's an orthopedic surgeon who's now retired, he used to tell me, he said, look, a monkey can do surgery. I'm looking at him like, really, uncle? Really, uncle? He said, yeah. He said, the difference is how well do they do after surgery? That's what separates people out. That separates good surgeons from bad surgeons, because every surgeon out there is not a good surgeon, and every surgeon is not a bad surgeon. But you say, what separates the good ones from the bad ones? Are the results. It's all about results. I realized that if I took your kidney out, you don't have an appreciation of all I had to do to get safely down to that kidney, remove that kidney, and then actually close it up. What are you going to look at? You're going to look at your wound. You're going to look at how it's stitched up and all this other kind of stuff. And you'll make a determination if I was a good surgeon or bad surgeon just by how well your wound is taken care of. I realize that. I know it's superficial, but that's what you do. You're going to look at the wound and how well it's done. I can tell you this, everybody matters. I had a guy who was a prisoner or whatever, and he had a big racial slur going across his abdomen. And the thing is that when I'm in the surgery and everything like that, I could have put his racial slur kind of crooked, but what did I do? I lined it right back up, because I'm just like, hey, you decided to put that on your body, and I'm going to respect your body. All right. And it was like, I hate, what he said, had it across his tattoo, and I lined it right back up so you can read it well. All right. So that's what I'm talking about. So I'm actually coming to the end of this conversation, because, what I wanted to do is help guys understand what happens after the procedure. The procedure itself only takes maybe 30, 40 minutes, definitely less than an hour. And we're wrapping it up after that. You're out of here. No surgery, no cutting. It's painless. Go home same day, back at work the next day, and our results are permanent. We're very strict about follow up. All right. You got to give us 40 days. You got to send pictures to us every 3 days. You got to stay in contact with us all through your healing period. You cannot have rough sex, you know, doing after 40 days up until 90 days. After 90 days, you have all the sex you want. I mean, that's what we tell. I tell all the guys the same thing. So we follow you. And if I see something going on, you're going to get a phone call. So basically, understand this, during the procedure, for us, it's just the beginning. We got to follow you for 40 days. The next 40 days are where patience, communication, and following instructions make all the difference. It's those 40 days, guys, when what makes all the difference. Are you somebody that's going to follow directions? I'm getting to the point I can tell when guys are not going to follow directions. I can pick out knuckleheads. I got guys coming from all over the country. So I can tell when not going to be with somebody that follows directions. All right. At least you got a question. I see a microphone in your hand.
Elite Grind wants to know, what do you do about getting morning wood that's natural?
Morning wood is natural, totally fine. So the thing is that this guy want to know about getting morning wood. We don't have a problem with that. Actually, we want you to get morning wood. I just don't want you to try to incite an erection on your own. I don't want you doing any masturbation or anything like that. If you get a morning wood or something walks by and you like it, great. Now, if it hurts and you wake up in pain, that's usually because you're wrapping it too tight. And we get that kind of thing all the time. So that's when you pick up the phone and you say, "Hey, I'm waking up in the middle of the night in discomfort." I'm like, "Okay, you're probably wrapping your penis too tight." Was there another question?
D Strike says y'all may be related because you have the same last name, and he wants to know if you accept insurance.
D strikes. Okay. What's up, cousin? I'm assuming you're a fussel out there. I would love to meet you and try to figure out this family tree. Now, I can tell you right now, we do not accept insurance. That was part of your question. Why? Because insurance doesn't pay for cosmetics. They won't pay for what we do. All right. There are two things out there. Things that guys need to know about and things that guys want to know about. I can tell you when I do talks, I start off my talk talking about things that guys need to know about. That's what we're talking about: prostate cancer, kidney stones, things like that, peeing blood, getting up too many times. Those things you need to know about. But things that guys want to know about, that's male enhancement and erectile dysfunction. So I've kind of moved over to this side. What I do now is things that guys want to know about. And those are the things that insurance companies don't pay for. Question.
Jonah's asking, do most clients do more than one treatment? And if so, how many procedures is the norm?
I can tell you that this guy's asking, do clients do more than one treatment? Dude, it's up to you. It's totally up to you. Because everybody doesn't come in at the same size. I got guys that are really big, above normal size, that want to have this procedure. And I got guys that are small that want to have this procedure. So the whole thing is get you to where you're comfortable. All right. I might have one guy come in, one procedure is enough. And you're like, I'm good. All right. I got guys that were big on the front end. They had the procedure. They came in for another procedure. I'm like, you trying to start an OnlyFans page? What are you doing, bro? I see you hanging like that. That's cool. Some guys out there, we got some OnlyFans dudes out there. Go to my gallery. It doesn't do it justice. I'm telling you, we got some OnlyFans guys. Go to urahard.com. That's UROHARD.com. Go on the gallery, look at the little menu. And, I don't have all my OnlyFans guys out there, but, they got some OnlyFans guys out there. But everybody's bigger because we got before and after pictures. So the size is the size that you want to get to. Do we have guys that are coming back? We have guys that come back all the time, you know, and I look at that as a positive thing, that guys trust me enough and they love the results enough that they want to come back and get bigger and bigger. Like I said, I've had it done twice.
Grumpy says, I have type 2 diabetes and I just found out that I'm borderline anemic. Is there a fix for me?
All right. All right. So Grumpy said I had type 2 diabetes. Yes, we can still make you bigger. Am I worried about your anemia? No, I'm not, because this is not a surgical procedure. If it was, I would have to be check your hemoglobin hematocrit, and trying to make sure, do I need to actually clear you for blood transfusions afterwards? If we were doing something big like take your kidney out or your bladder. For this little simple procedure, I'm not worried about that. All right. So, we're not in there like suction and trying to get down to the bleeder. That's not what we're dealing with here. So I'm not worried about your anemia. All right. But I am worried about your diabetes more than your anemia, because if your diabetes is poorly controlled, then you're not going to heal like you should. And now I got to pay close attention to you because you're not healing like you should heal. So I'm busy, man. And I'm going to tell you up front, Grumpy, I'm not doing your procedure unless your A1C is less than 8. Why? Because you're going to be that guy. you're going to be that guy that's not going to heal up. And I'm going to be kicking myself because I'm just like, man, I knew better than to do this procedure, but I'm too seasoned for that, bro. So the thing is, I got cutoffs. So we'll help you get your A1C to less than 8, but understand that, that's how we get you through there because we want to optimize you before the procedure. So yeah, you can have this done. Not a problem. I got you, bro.
He says he's at 7.
All right. Grumpy's at 7. Come see me, man. Come see me. Dude, we can tighten you up right now. I'm telling you, you're in that zone. You're in that zone. Come join the BDL, the BD, the Big D League. That's how we roll over here. I'm gonna give you one of my hats. That's right. One of these hats right here. Only big boys wear these hats.
Big Dog says, what if he has a pump? Can he still get the procedure?
What if he has a pump?
An implant.
Oh yeah. A penile implant. I do this all the time for guys with penile implants. Why? Because there are two things that happen. When you get a penile implant, you're going to lose girth and you're going to lose length. A lot of doctors don't tell you about that, but I can tell you right now, you lost size when you had your implant placed. I know this because I used to place implants. All right. So it's a very litigious procedure. And they should talk to you about all that in your consent form. They want to make sure you understand that you're going to be smaller. We got you back to having erections, but you're going to be smaller. But here's what I can do. I can help you regain all that size that you lost and more. So yes, do we do that? Yes, we do it all the time. Is it safe for us to do that? Yeah, it is safe. Why? Because I'm going to cover you with antibiotics before we ever start the procedure. All right. You're going to actually get IV antibiotics because I want to make sure we do nothing to infect your implant. Then the other thing is I know where the implant is located. Why? Because I'm a surgeon. It's inside the corpus cavernosum. There are certain tubes in certain areas. So yeah, we're doing injections in the penis, but I know where to put the needle. So I'm comfortable. Why? Because I've one place to implant. And then afterwards, we're going to keep you on antibiotics because I want to make sure that you heal up well. So, have I done this before? Several times over and over. And I've had guys with implants that have come back more than once. All right, another question.
Grand Slam Cam.
Grand Slam Cam.
It says, is it a certain size you recommend? And do you do consultations beforehand?
Oh, yeah. So, Grand Slam Cam, I can tell you we do consultations for free. You can call today. All right. And the thing is that if we can't get to you today, we will schedule one for you. But our consultations are free. Now, you can get up to whatever size you want to be. I can tell you, Grand Slam, you're going to be swinging that bat. I'm going to get you in the game. Understand that. That's what we do.
Okay, I got a few questions. The first one, Andre says, if you had prostate cancer and had radiation therapy, what if you had those?
So, Andre wants to know if you had prostate cancer and radiation therapy. Can I make you bigger? Yes, I can. But that won't just be our only focus because prostate cancer, radiation therapy, now I'm concerned about your erections. So it makes no sense to just be bigger, have a big penis if it's not going to work. So lucky for you, that's what I do. So not only are we going to make you bigger, we're going to make you harder. So we're going to help you out with your erections also. And I've got several patients that have gone through prostate cancer surgery. I've had them even have the nerves cut, where they can't get erections at all, and they're all back in the game. That's what we do.
So there's a question, if I've lost size and have less sensitivity, can you help me?
Yes, we can do that. The question is, if I lost size and have less sensitivity, first of all, as a doctor, I got to understand why. Why did you lose size? Why did you lose sensitivity? And then we got to concentrate on what we got to do to make it better. So the thing is that you got to understand why, what caused it to get a good result. Can we do something about that? Yes, we can.
He also wants to know if it's length and girth.
Now, what we've been talking about today is a girth procedure, guys. The question is it length and girth? Now, I can tell you that when we make you bigger, it's going to be bigger, heavier, and it's going to hang longer. But this is not a lengthening procedure. We can make it longer by cutting the suspensory ligament, which is a lengthening procedure. So if you say, I just want to be longer, that's different. Remember, at Your Heart for Men, we make you bigger, we make you longer, we make you harder. Bigger is increasing girth, longer is increasing length, harder is erectile dysfunction. So we cover all that. The question is, what do you want? Or do you want several? Or do you want it all? We got you. We can do that. Was there another question? Yeah. All right. So I can tell you the take home message here is recovery isn't the part you endure, it's part of the treatment. So part of the treatment actually is recovery, and that goes on even after you leave our office. That's why we're so intentional about how we follow up with you to make sure you're getting results. Now, next week, we're going to talk about how much bigger can you really get. So I'm going to be talking about that on next Thursday on our live talk, usually between 12 and 1. Next week, we're going to answer those questions that people want honest answers about. What's realistic? What is possible? And when is bigger too much? Because they're going to ask, can you be too big? I know that question is going to come out. It's definitely going to come up. But once again, I can tell you, I've enjoyed my time with you for this week. And I want you to check us out next week when we do our next talk. So this is Dr. Fussell with Your Heart for Men. We make you bigger, longer, harder. You can give us a call, 478-225-9324. You can go to our website. You can check out our blogs. You can listen to us on podcasts. We're out there trying to get this information out. So you can go and check us. When you want to find out real information, go to my website. Go listen to my blogs. Read that information. We got a blog section on our website that really breaks things down. And we're talking about even some of these talks that we've had. So all the information's out there. Go check it out. Until then, keep them horns up. Horns up, my brothers. Y'all shut me down.